Hi, my name is Rhea Nair from Inores International. Today we are going to talk about the risk of bias assessment scales for different studies. What is risk of bias assessment? It's actually a systematic process conducted to evaluate the quality of a research study. Basically helps us find out any sources of bias or errors in the study that could affect the reliability and validity of our study results. The assessment is typically conducted by examining various aspects of the study design, conduct, and analysis. So why exactly are we doing a risk of bias assessment? So that we can check the validity of the study, we can trust the results of the study, we can do comparability of studies for transparency and reproducibility, for evidence-based medicine, and for improving our research quality. So the domains for risk of bias assessment include: first, randomization was the allocation of participants to different groups, random and unbiased. Second, blinding or masking. We check whether the participants, investigations, and outcome assessors were blinded to treatment allocation to minimize bias. Third is incomplete outcome data or the attrition bias. We check whether there was proper handling of missing data to avoid any biased results. Fourth is selective reporting. Were all predefined outcomes reported, or was there selective reporting that could introduce any bias? Then there's allocation concealment. We see how well was the process of concealing the treatment allocation implemented to prevent any selection bias. Then there's baseline characteristics. We check whether the baseline characteristics of participants were comparable between different study groups. And other potential sources of bias could also be checked, which includes any other factors that might introduce bias to specific to that study design. So how do we even perform a risk of bias assessment? First, we'll understand the study design. Then we'll select a tool or a framework for that study design, identify the key domains under it, collect information from the study, and then evaluate each domain. So after we are done evaluating the domains, we'll summarize the findings from it, consider the overall risk of bias involved, then document the rationale, then interpret the results from it, and then report the findings. Now we are going to talk about the scales used for different study designs. First is the randomized control trial. The tool used for it is a Cochrane Collaboration's risk of bias tool. Domains assessed under it are the random sequence generation, allocation concealment, blinding of the participants in personnel, blinding of outcome assessment, incomplete outcome data, selective reporting, and other sources of bias. So here we can see the Cochrane Collaboration's risk of bias tool, which is used for randomized control trials. On the x-axis is the domains which we have discussed, and on the y-axis are the studies which have been used in the research article. Here the plus sign denotes for the low risk of bias, minus for the high risk of bias, and the question mark indicates an unclear risk of bias, and based on it, the findings can be summarized. The second study is the observational studies, a cohort or case control, for which one of the tools which can be used is the Newcastle-Ottawa scale. Domains assessed under it is the selection, comparability, exposure, or outcome. This is how the Newcastle-Ottawa scale for observational studies look like. The domains under which are selection, comparability, and outcome, which include different subcategories of their own, and the studies which are included in the research article have also been documented. Next is the systematic reviews and meta-analysis. One of the tools used for it is AMSTAR 2, assessing the methodological quality of systematic reviews. The domains assessed under it is protocol registration before commencement of the review, adequacy of the literature search, justification for exclusion of studies, risk of bias from individual studies being included in the review, appropriateness of meta-analytical methods, consideration of risk of bias when interpreting the results of the review, assessment of presence and likely impact of publication bias. This is how the AMSTAR 2 risk of bias chart looks like for systematic reviews and meta-analysis. We can see the studies on the x-axis above, and on the left we can see the domains which are included under it to check the risk of bias involved in that study. Next is for cross-sectional studies. One of the tools involved is AXIS, which means the appraisal tool for cross-sectional studies. The domains assessed under it is the study design, sampling, data collection, study objectives, and the statistical analysis. This is the AXIS tool used for evaluating the risk of bias in a cross-sectional study. For diagnostic accuracy studies, we'll use the Quality Assessment of Diagnostic Accuracy Studies tool. The domains assessed under it is the patient selection, index test, reference standard, flow and timing. The Quadas 2 tool includes the studies included in the research article above. The domains are on the right side, which includes the patient selection, index test, reference standard, flow and timing. And also, as usual, The plus sign indicates the low risk of bias, the minus indicates the high risk of bias, and the question mark indicates the unclear risk of bias. Next is the qualitative research. The tool used for it is the Critical Appraisal Skills Program Qualitative Checklist. The domains assessed under it are the research design, data collection, relationship between the researcher and participants, rigor, and data analysis. This is the CASP qualitative checklist used for qualitative research studies, with the studies included in the research article above and the domains included on the left side, and the total score is then given to each study to evaluate the risk of bias involved in that research article. This is the Robbins I tool, which is the risk of bias in non-randomized studies of interventions. It is commonly used in non-randomized studies such as the cohort studies and case control studies when evaluating interventions. The domains assessed under it are confounding bias, selection bias, bias in classification of interventions, bias due to deviations from intended interventions, bias due to missing data, bias in the measurement of outcomes, bias in selection of reported result. Next is the ROB 2.0, which is the revised Cochrane risk of bias tool for randomized trials. It is used in randomized parallel group trials, cluster randomized trials, randomized crossover trials. The domains assessed under it are the bias arising from randomization process, bias due to deviations from the intended interventions, bias due to missing outcome data, bias in the measurement of the outcome, bias in selection of the reported result. So here we look at the ROB2 risk of bias chart for the randomized controlled trials. Here the D1 to D5 domains are mentioned below, and also the studies which are included in the article are on the left side. Overall risk of bias is obtained for this chart, and it is represented by X, which is high risk of bias, minus some concerns for the risk of bias, and plus is low risk of bias. The next is the Robbins I risk of bias chart for the non-randomized studies. Here the D1 to D7 domains are mentioned, and the studies which are included in the research article are on the left side. Here also by judgment, we get an idea if there is a moderate risk of bias or a low risk of bias present. So overall, we do the risk of bias charts in order to get an idea about the validity of the research study, and also to check the reliability, to check the trustworthiness of the results included in the article.